Hello, my name is Aloha Catbagan, and my presentation is titled Social Determinants of Health, Housing Instability. When you think about health outcomes, it's not just about medical care. It is shaped by many other factors. Sure, medical care is important, but understanding other factors like how people live, work, and grow is also important. These factors are known as social determinants of health, or SDOH. The social determinant of health account for a significant number of health disparities. The most influential determinant is housing instability. Housing instability is closely related to social economic status, access resources, and community well-being. There are many reasons for housing instability. It could range from the high cost of housing and the conditions that require frequent moving or conditions that cause homelessness. These conditions create barriers to achieving and maintaining good health. This presentation will examine the ways in which housing instability influences physical, mental, and social health. This presentation will also explore the causes and will outline strategies for addressing this determinant through policy and public health interventions. According to the U.S. Department of Health and Human Services, housing instability refers to the lack of safe, stable, and affordable housing. This includes frequent moves, overcrowding, living in unsafe or unhealthy environments, as well as risk of eviction or homelessness, cited from the U.S. Department of Health and Human Services 2022. Families that experience unstable housing often spend most of their income on rent. This leaves less money for food, health care, and education. Also, those who face eviction and homelessness create disruption in employment, schooling, as well as health care access, cited from Desmond 2016. This problem is closely related to socioeconomic inequities, structural racism, and systemic barriers in the housing market, cited from the U.S. Department of Health and Human Services 2022. Housing instability is a major determinant of health that contributes to chronic disease, poor mental health, and health inequities. Without coordinated action across healthcare, housing, and policy sectors, instability will continue to harm the vulnerable populations and strain community resources. Linking housing instability to health and inclusion/exclusion. Poor housing contributes to many physical health problems. Problems such as mold, pests, and inadequate heating and cooling can increase the risk of respiratory and cardiovascular disease, and living in overcrowded conditions increases the risk of infections, cited from Krieger and Higgins 2002. Housing instability is largely associated with poor mental health outcomes. Those with worries about housing instability experience uncertainty that creates chronic stress, anxiety, and depression. Zuglia et al. 2011. In children, frequent moves and unstable housing can disrupt developmental stability, increase the risk of behavioral challenges, and cause poor academic performance, cited from Cutts et al. 2011. Housing instability also interferes with the continuity of care. Those without a stable address may struggle to maintain health insurance, as well as those without stable employment. It is also difficult to receive mail regarding medical appointments or store medication safely without a stable address. Studies show that homelessness is associated with higher risk of emergency department visits, readmission, and lower rates of preventive care, cited from Baguette et al. 2010. Although housing instability is not an isolated issue, it is the outcome of a broader systemic inequity. The rising cost of housing, lowered stagnant wages, and a limited amount of affordable housing increases instability, especially in the urban areas, cited from the Joint Center of Housing Studies of Harvard University 2022. Historical and ongoing discriminatory practices such as redlining, exclusionary zoning, and inequitable lending have affected racial and ethnic minority groups, cited from Macy and Denton 1993. Unfortunately, weak tenant protection and a limited amount of public investment in affordable housing increases these disparities. Addressing housing instability requires extensive policy and public health strategies. Some interventions to address housing instability are explored, but more on this later as it will be explored in a later slide. While exclusion is closely related, not all issues are a direct component of housing instability in the SDOH framework. One issue that is not a direct component is neighborhood level factors such as crime rates, walkability, or access to green space. These factors are better classified under the broader SDOH category of neighborhood and built environment. Another issue that is not a direct component of housing instability is household crowding due to cultural or extended family living arrangement because it is not involuntary. Voluntary housing mobility is also not a direct component of housing instability because it is voluntary. An example of this would be relocating because of work or education opportunities. It is not associated with instability or risk. Finally, home ownership preference or housing design choice that reflect an individual's lifestyle instead of structural barriers are not a direct component of housing instability. Knowing the difference between inclusion and exclusion elements is important as the framework clarifies the specific condition that defines housing instability as a social determinant of health so that intervention are appropriately implemented towards the population most at risk. Cited from Krieger and Higgins 2002 and Sandel et al. 2018. The first literature review I will be discussing is Correlates of 6-month Housing Instability Among U.S. Adults by Veteran Status, exploring study using data from the All of Us program by Badon et al. In 2024. The All of Us research program has established a structured framework to measure various social determinants of health using concepts from the World Health Organization's conceptual model as well as the Healthy People 2020 framework. Some of the areas include economic stability, neighborhood and built environment, education and social context, and healthcare access. Cited from Badon et al. 2024. One study from the All of Us program is to examine 6-month housing instability among U.S. adults, comparing veteran and non-veteran using data from the All of Us program. It offers insight into how housing insecurity manifests across subpopulations, especially those with veteran status. This article suggests housing stability is captured through surveys and follow-up with individuals. Veterans were not significantly associated with housing instability. Risk factors associated with higher housing instability risk in both groups include being a male, middle age, unmarried status, lifetime cigarette smoking, and worse self-rated health. These factors increase the likelihood of housing instability regardless of veteran status. Two protective factors are higher income and health insurance. Both were associated with lower odds of housing instability across both groups. Factors that correlate specific to non-veterans are unemployment and any lifetime alcohol use increased odds of housing instability. Any lifetime drug use was associated with lower likelihood of housing instability, an unexpected finding. Racial disparities are observed only among non-veterans. Despite policy emphasis on veterans, this study suggests that housing instability is similarly preventive in both veterans and non-veterans once confounders are considered. The result underscores the nature of housing instability that is rooted in socio-demographic, economic, and health-related vulnerabilities. Distinct correlation observed in non-veterans surrounding employment, substance use, and racial disparities indicate a need for tailored intervention. Unexpected findings such as drug use warrants cautious interpretation and more in-depth research. Cited from Badon et al. 2024. The next literature review I will be discussing is Medicaid waivers and tenancy support for individuals experiencing homelessness, implementation challenges in 4 states by Thompson et al. In 2021. There are 4 states that have increasingly turned Medicaid Section 1115 demonstration waivers to fund pre-tenancy and tenancy support services for individuals experiencing homelessness. These 4 states are Illinois, Louisiana, New York, and Oregon. The services provided are housing assistance, landlord coordination, educational support, and housing stability planning. These services are interventions that address housing instability as a social determinant of health. Cited from Thompson et al. 2021. It is a qualitative study of 4 early adopter states. Research conducted 28 semi-structured interviews with 36 stakeholders, including government administrators, healthcare providers, nonprofit housing staff, and consultants to explore operational challenges in implementing these waiver-based tenancy support programs. There were 7 key challenges as themes on different interviews. The first one is housing supply shortages and not in my backyard resistance. These shortages of affordable and accessible housing, along with community resistance to congregate living and housing for high-need populations, severely constrain program effectiveness. The second key challenge is silos between healthcare and homeless service systems. Structured fragmentation and separation between behavioral health, physical health care, and housing entities impeded coordination. Stakeholders emphasized the need for administrative mechanism, integrated policies, and shared data system to bring together these silos. The third key challenge is enrollment and retention barriers. Those experiencing homelessness are unsheltered and have no address, making outreach and Medicaid enrollment and eligibility verification difficult. Coordination between Medicaid and housing system is particularly difficult as it is. The fourth key challenge is contracting and payment complexities. Secure an agreement with tenancy support providers, establish reimbursement mechanism, and aligning service delivery across sectors proved to be burdensome. The first key challenge is workforce recruitment and retention. Developing a stable workforce of tenancy support professionals who can navigate comprehensive rules and manage complex client needs proved to be difficult. The sixth challenge is waiver sustainability and durability. Uncertainty about the lifelong lifespan and funding of Section 1115 waivers made it challenging to plan for sustained implementation. The seventh key and final challenge is administrative burden and crowd-out effects. Complex requirement and documentation needs often overwhelm service providers, detracting from direct service delivery, cited by Thompson et al. In 2021. Even with these obstacles, 3 of the 4 states, Louisiana, New York, and Oregon, achieved meaningful progress in launching and scaling their initiative. The fourth state, Illinois, stalled its implementation to explore other methods of providing tenancy support outside the waiver mechanism, cited from Thompson et al. In 2021. The final literature review I will be discussing is the impact of social determinants of health on medication adherence, a systemic review and meta-analysis by Wilder et al. In 2021. This literature review utilizes systemic reviews, meta-analysis, and large observational studies to examine the association between social determinants of health, specifically housing instability and medication adherence. The area of homelessness and condition-specific adherence, in particular HIV care, show unstable housing and homelessness predict poorer antiretroviral therapy adherence and worse biomarkers. Although some of the studies suggest that the magnitude can vary once the individual receives supportive housing or case management. Those that are experiencing homelessness with psychiatric disorder, a recent systemic review found persistent adherence barriers even with intervention show promising but mixed adherence benefits, cited from Wilder et al. 2021. Housing instability refers to homelessness, frequent relocation, eviction or eviction risk, burden with cost of housing, overcrowding, and substandard condition. Those without stable housing may experience medication loss or theft, lack of secure storage/refrigeration, competing basic needs, transportation barriers, and discontinuity of care, cited from Wilder et al. 2021. Heterogeneity is how both housing instability and adherence are measured. Self-report versus pharmacy claims versus biomarkers limits precise pooling and causes causal inference. Many of the studies are cross-sectional with potential residual confounding, for example, comorbid substance use and insurance instability, cited from Wilder et al. 2021. Given the medication harm that is associated with housing instability, addressing housing needs is directly relevant to medication adherence. Evidence support that pairing tenancy supports with care coordination, legal medical-legal partnership to prevent eviction, coverage of non-clinical support through Medicaid, clinic-level screening, and referral programs for housing instability, especially when it is coupled with transportation and medication delivery, enhance medication adherence, cited from Walder et al. 2021. In this slide, I will be discussing the population effects of housing instability. Housing instability affects individuals and families with limited financial resources that struggle with rising housing costs. Disproportionately rent-burdened, many low-income households spend more than 30 to 50% of their income on housing, cited from the U.S. Department of Health and Human Services 2022. Blacks, Hispanics/Latino, and indigenous population are disproportionately affected due to systemic racism, discriminatory lending, redlining, and inequities in employment opportunities. Therefore, minority groups face higher rates of housing discrimination, eviction, and homelessness, cited from the U.S. Department of Health and Human Services 2022. While veterans have access to some housing support, HUD, BASH, and tiny home communities, there are still many that experience homelessness or unstable housing. They are often linked to PTSD, disability, substance use, or unemployment. Children in unstable housing face developmental delays, poor school performance, and long-term socioeconomic disadvantages. Children often experience food insecurities and negative health outcomes, cited from the U.S. Department of Health and Human Services 2022. Seniors with fixed income face eviction or unsafe living conditions when rent increases, making them vulnerable to eviction. This puts them at greater risk for social isolation, falls, poor health, which can progressively worsen due to inadequate housing. Individuals with chronic illness, disabilities, or mental health conditions are at higher risk for eviction, homelessness, and medical complications when housing is unstable, cited from the U.S. Department of Health and Human Services 2022. Housing instability does not occur in isolation but crosses with other SDOH such as poverty, employment insecurities, structural racism, and limited social support. Many of those affected are often those of racial and ethnic minority groups, those with disabilities, and those who live in poverty, cited from the U.S. Department of Health and Human Services 2022. This highlights the systemic and structural roots of housing instability, making it both the driver of health disparities and a consequence of inequitable social systems. In this slide, I will be discussing medication adherence and health compliance. Housing instability is a significant social determinant of health that directly influences an individual's ability to maintain medication adherence and comply with medical treatment. Stable housing provides the foundation for routine, security, and access to resources that support health. When individuals lack this stability, both long-term and short-term health outcomes are compromised. Medication adherence is an area that is highly impacted. Patients who experience unstable housing often face challenges in obtaining prescriptions consistently, storing medication safely, and maintaining regular dosing schedules. Financial strain forces many to choose between paying for housing, food, or medication. This can lead to skipped doses or unfulfilled prescriptions, cited from Walder et al. 2021 and Sandel et al. 2018. For instance, those with chronic conditions such as diabetes and hypertension, poor adherence accelerates disease progression and increases the risk of hospitalization. Individuals without stable housing have greater difficulty attending scheduled appointments, following dietary or activity recommendations, and engaging in preventive care, cited from Walder et al. 2021 and Sandel et al. 2018. Missed follow-ups and fragmented care contribute to higher emergency department utilization, greater reliance on acute care, and poorer disease control. Housing instability is also associated with higher levels of psychological stress, depression, and substance use, which further weakens adherence and compliance. Without intervention that addresses both housing and health at the same time, medical treatment alone cannot achieve optimal outcomes. Integrating healthcare and housing support has shown promise in improving adherence, stabilizing health conditions, and reducing disparities. Stable housing enables patients to follow prescribed therapies, maintain medical appointments, and engage in healthier lifestyle, ultimately improving overall health compliance and equity. In this slide, I will be discussing how change is necessary. As you can now see, stable housing is essential for physical, mental, and social well-being. Housing instability undermines health by disrupting access to preventive care, medications, and safe living conditions. Such instability is associated with elevated risk for chronic illness, infectious disease, mental health disorders, and poor developmental outcomes in children, cited from Wolf et al. 2020. Housing instability consistently predicts poorer medication adherence as shown across multiple studies. Parents facing housing insecurities are more likely to delay or skip medications, often due to cost trade-offs, lack of storage, or transportation challenges, cited from Mulder et al. 2021. Housing instability impairs chronic disease management and medication adherence. Housing instability results from and exacerbates structural inequality and discriminatory housing policy that persists across the United States, cited from the World Health Organization 2023. Housing reflects structural inequities requiring systemic policy responses. Challenges to intervention such as limited affordable housing supply, administrative silos, and sustainability concerns shows the need for more coordinated cross-sector approaches, cited from Thompson et al. 2021. Housing must be recognized as a foundational healthcare intervention. Tackling housing instability through coordinated housing, healthcare, and policy efforts not only promotes equity but also prevents disease, improves essential treatment adherence, and alleviates strain on the healthcare system. Addressing housing instability requires multi-level strategies that incorporates healthcare, policy, and community action. Based on current evidence, the following recommendations are proposed. The first proposal is to integrate housing support into the healthcare system. Healthcare organizations should screen for housing instability as part of routine care and establish referrals to housing resources. Embedding medical legal partnerships and tenancy support services into clinical settings can help address eviction risk, landlord disputes, and unsafe housing conditions, cited from the U.S. Department of Health and Human Services 2022. Housing programs like Moving into Opportunity demonstrates that relocating families from high poverty neighborhoods to low poverty environments can yield long-term benefits such as reducing obesity and diabetic risk, improve income, and education attainment, cited from the U.S. Department of Health and Human Services 2022. Another intervention called Housing First prioritizes providing permanent housing before addressing other challenges such as mental health or substance use. This model has proved to be effective as it improves both housing and health outcomes, cited from Semberis et al. 2004. In the past, public health interventions have improved population health by addressing housing issues such as sanitation, ventilation, and fire safety. Today, efforts extend to enforcing housing codes, implementing healthy homes program, and advocating for affordable and healthy housing policies, cited from the U.S. Department of Health and Human Services 2002. In the community, anti-displacement efforts and neighborhood safety investment can protect residents from being priced out of their community while fostering stable, health-promoting environments. Implementing community development and anti-displacement policies is the next proposal. On a community level, Strategies should focus on reducing displacement pressures and improving neighborhood safety. Policies that expand tenant protection, preserve affordable housing, and invest in safe neighborhoods can mitigate the root cause of housing instability. Cited from Condo et al. 2018. Another proposal is to expand cross-sector partnership, strengthening collaborations between healthcare systems, housing authorities, and community-based organizations is very important. Medicaid demonstration waivers and managed care programs should be leveraged to fund tenancy support, case management, and rental assistance for high-need populations, cited from Thompson et al. 2021. Cross-sector partnership between healthcare system and housing organization that incorporate service and recognize housing as a health intervention. These collaborations believe that housing is not only a social issue but also an important health intervention. By integrating housing and healthcare services, organizations can provide thorough support for those facing instability. Offering affordable housing initiatives, federal, state, and local government should increase funding for affordable housing development and expand supportive housing programs that puts together rental assistance with wraparound services. Evidence demonstrates that stable housing reduces hospitalization, improves medication adherence, and enhances overall health outcomes, cited from Walder et al. 2021. Promoting equity-centered policy reform because housing instability disproportionately affects racial and ethnic minority groups, low-income families, and individuals with disabilities. Housing policy must explicitly address structural inequities. These include addressing discriminatory lending practices, redlining legacies, and systemic barriers to home ownership and stable rent opportunities. Cited from Sandel et al. 2018. Offering housing choice vouchers, rent stabilization policies, and expansion of public housing programs, cited from the U.S. Department of Health and Human Services 2022. The final intervention would be community development effort that aims at reducing displacement and improving neighborhood safety and would be an inclusion effort. This would in, this would support long-term stability. Housing instability is not just about individual household, but it is about a broader condition within the community. When neighborhoods go through gentrification, rising rents, and unsafe environments, residents are at greater risk for getting evicted. Homelessness and long-term instability, cited from Sendel et al. 2018. Housing instability is a critical social determinant of health with deep implication for physical, mental, and social well-being. It affects access to care, medication adherence, chronic disease management, and overall well-being. Evidence consistently showed that individuals who face unstable housing experience worse health outcomes, higher healthcare utilization, and greater barriers to achieving long-term stability compared to those with secure housing. These impacts are magnified by intersecting factors such as poverty, racial and ethnic inequities, and limited access to supportive resources. Its root causes lie in structural inequities, economic pressures, and policy shortcomings. Recognizing housing as more than a commodity, but as a prerequisite for health, requires a shift in both public health and policy approaches. Addressing housing instability through affordable housing initiatives, housing first models, and integrated healthcare housing interventions offer a path towards reducing health disparities and advancing health equity. While healthcare systems have traditionally focused on clinical intervention, addressing housing instability requires broader multi-sector approaches. Partnership between healthcare providers, housing organization, and community agency show promise in reducing housing instability and improve outcomes. Policies that support housing, protect tenants, and increase affordable housing supply are equally important in addressing structural drivers of health inequities. Ultimately, improving housing stability is not only a matter of social justice but also a public health imperative. Recognizing housing as a foundational determinant of health can guide future interventions, research, and policy reforms aimed at reducing disparities and promoting health equity. Sustained efforts at the clinical, community, and policy levels would be essential to ensure that stable housing is treated as a core component of health and well-being. This concludes my presentation. Thank you.